While the first resignation letter submitted by medical professors last month took effect on Thursday, there have been no reports of professors leaving their posts yet. An emergency committee of medical professors will meet online Friday afternoon to discuss whether to suspend outpatient services once a week as they struggle with fatigue due to extra workload. Lee Eun-hee tells us more.
An emergency committee of medical professors will convene on Friday afternoon to discuss the implementation of a weekly day off. Earlier this week, medical professors announced they had reached their mental and physical limitations as they provide cover for absent junior doctors, and they will halt medical services for one day next week. Friday's 9th online meeting will decide whether to maintain the weekly day off going forward. Tensions are also high amid the potential for mass resignations by the medical professors. It has been a month since they began submitting their resignations, which began to take effect as of Thursday. The Medical Professors Emergency Committee said that even though the government has not accepted the resignations, Thursday marked the day when the first resignations submitted would take effect under civil law. As yet, no related action by doctors has been reported so far. The Medical School of Seoul National University, one of the so-called Big Five general teaching hospitals in the country, said departures will be carried out based on individual choice. But 4 leaders of its school's emergency council have confirmed they will be leaving the hospital on May 1st. The Emergency Council at the Med School of Ulsan University also announced that its medical professors' resignations will begin on Thursday, and those who are unable to resign immediately will halt medical services for one day per week from May 3rd. However, emergency and critical care services are not expected to be affected. Meanwhile, the Presidential Special Committee on Medical Reform held its first meeting on Thursday morning. The government-proposed social consultation meeting will focus on reducing regional medical disparities, revising medical laws, supporting costs at hospitals, and increasing medical personnel. However, the Korean Medical Association, the largest doctors group, and the Korean Intern Resident Association have declared that they won't participate. The government had encouraged these medical groups to participate, but they refused to back down from their demand that the government completely withdraw its medical school expansion plan.
The Special Committee on Medical Reform will help make South Korea's healthcare system better by bringing people together to talk about changes. The government once again asked the KMA and the KIRA to participate.
He said discussions on the current medical dispute regarding the government's plan to expand the medical school enrollment quota by 2,000 from next year would be excluded. Lee Eun-hee, Arirang News.